Diagnosed with a chronic form of arthritis as a teenager, Billy Tincher has been in pain for most of his life.
So, I mean, it's just, they say I've had it since I was 18, and it's nothing they can. I've had cartilages took out, I've had a hip replacement, and they said they'd have to replace my body or be bionic. And they said that wasn't in the case right now, so, because there's no cure for what he's got. And said there never will be, because it's too far gone, like this crystallized. My elbows, I've got knots saying like this on the bottom of my feet. And you hit a rock and you stop. Or anything, if you hit it in the right place, you cuss.
Over time, his disease progressed to the point where Tincher was no longer able to work his farm or care completely for himself.
Well, I used to pick up a 100-pound feed sack and a bale of hay. And now I do well if I can pick up an empty feed sack and the strings off a bale of hay. And I used to have big arms, like this. I mean, I was muscles. Well, if it wasn't for my wife, I couldn't do nothing. I'd be in a nursing home because she does my pills. She rolls my sleeves up because when I roll them up, I got one sleeve down here and one sleeve up here. I mean, I can't, that's as far as I can open that hand. And I mean, it's not, I don't want nobody to feel sorry, but it's there. Nothing I can do about it.
Most of the doctors Tincher has seen have simply prescribed him higher doses of drugs as his disease worsened.
You think all the pills I take a day, and what it boils down to, you have to swallow that many times, once and twice a day. It gets old. And they took 3/4 of my stomach out when they found out I had a bleeding ulcer that probably part of the arthritis medicine had caused the ulcer. So you rob Paul and pay Peter. That's what it boils down to.
But after meeting UK physician Dr. Roberto Cardarelli, Tincher says he finally found someone who is able to help him.
Well, he just didn't lay a prescription down and say, here's 150, 120 oxycodones, 30, see you in 30 days. He doesn't do that. As I say, he just doesn't, he's concerned with you. You're not here as a number. As my wife said, the one doctor was like a herd of cows running through a chute. Put an ear tag in your ear and out the chute you go. And here you're not. He knows your name. A lot of doctors I've been to here in town don't even know your name.
As for other patients who may be experiencing similar debilitating pain, Tincher has some words of advice. Seek help now rather than later.
The first thing you want to do, you don't let it go like I did. I should have went probably every 6 months instead of every 6 years until it got really bad. And then after it got so bad, I had to go to the doctor. But to get things to work right, you need to go at least every 6 months, at least twice a year. Now, if I was going to, there was no other doctors in the world I'd send you to. And there's some good doctors out there, but as I say, Roberto he's my man, and I'll back him 100%.